Makakapanayaw na po natin ngayon si Presidential Advisor for Entrepreneurship, Joey Concepcion. Magandang umaga po sa inyo, sir. Si Connie Season po ito.
Magandang umaga rin, Connie.
Ito ho, plano nyo na bumuo po ng advisory group ng mga eksperto habang papasok na tayo sa tinatawag na normalcy. Sa mahigit na 2 taon po na nasa COVID pandemic po tayo. Papaano ito gagawin? Ano ho ang masasabi natin kung kailan ba ito masisimulan kaya?
Well, mamayang hapon, I will be meeting with the medical doctors na we've been consulting for quite some time, no? At kasama rin dito ang mga data analyst natin, yung Okta Research. So of course, Dr. Salante, Dr. Ted Herboso, Dr. Ed Salvania, and sila, may mga iba pa dyan na sasama dito. At yung Okta Research, Michael T., Dr. Michael T., Guido David, and of course, Father Nick Austriaco. And then we have one economist that we invited also, si Romy Bernardo. No? So, ang objective ng this expert group that will advise us is, kasi we're now moving from a pandemic to endemic. And importante dito kasi halos lahat itong mga doctors na to, parating na-invite sa television, sa radyo. At importante na yung mensahe natin will be very clear, no, for the private sector and of course the public dito sa mga alert levels, sa mga data na nilalabas yung infection level. So we have to make sure that, you know, yung infection level na maski tumataas, we should not be too much of concern. Ang dapat i-focus natin yung hospital capacity. So these doctors and data analysts will meet this afternoon and align, no, what we call this, our messaging, no, and of course their advice to the private sector as well, no. And alam mo naman, Connie, na we're facing now this price increases, no, dumarating ngayon to. And we want to be sure, no, that yung alert levels natin will continue to be where it is, no, and hopefully ang isang recommendation namin is eventually setting it aside, no. So, pero what are the parameters that will have to happen before you're able to remove totally the alert levels, no? So those are things that we will be discussing, no?
Pero sir, ito ho, do you agree, halimbawa sa Cebu province, di ba, pinapanukala nila doon na hindi na gawing mandatory yung pagsusuot po ng face mask sa mga open spaces, ano? At kasalukuyan nagkasundo na sila ng IATF na magkaroon muna ng implementing rules and regulations, ano, bago po maipatupad ito. So sangayon ho ba kayo na po pwede nang gawing mandatory rin dito sa atin po sa NCR kaya ang pagsusuot ng face mask?
Indoors or outdoors?
Outdoors. Yun po ang sa Cebu rin eh.
Well, at this point in time, that's what we will discuss. One of those topics nga in itong paggamit ng face mask outdoors. Walang problema sa indoors. Dapat mandatory yan, mga restaurants and all of that. No? So there's no issue with that. Pero sa outdoors, as our position is, let's not do anything now under the Duterte administration because they have set these rules, and let us just follow, no, yung kasi itong whether we change it, whether we encourage the use of face mask outdoors but not mandate it, has to be discussed, no, and each doctor has their own opinion, and that's why we're doing this, no, to really bring all the experts together, no. And these are well-respected doctors, no? Sila Ted Herbosa, sila Edson Salvania, etc. No? So I don't have the answer. I have my own position, but my position may differ from the rest. No? So hopefully we will all agree what is the best advice to the private sector, no? And take it from there. No? Hindi lang yan, no? Yung gradual shift, no, from this pandemic to endemic. How do we transition out from the public state of health emergency? We cannot be forever in the public state of emergency. How do we shift now to the removal of that? It will take time. What about the vaccine manufacturers? How long will it take from the emergency use authority to a certificate of product registration? So all of these things i-discuss namin, we have to start thinking along the line of preparing on the move from a pandemic to an endemic. So it's not overnight that you can say, okay, tanggalin na natin ang public state of emergency. No? Hindi ganyan. No? It is a process that you have to go through, and we have to start discussing that.
Opo. Pero sa tingin niyo, kailan kaya ito maipapatupad? Yung mga consultations, meron ba kayong timeline na tinitignan? Halimbawa, sa pagdasapit po ng Burr months kaya o kaya ng Disyembre, makikita ho ba natin that we can really transition despite the fact na meron hong ibang mga kaso pa sa ibang mga lugar no, na nagtataasan ng COVID?
I think the target is siguro we can see whether we can do it by the end of the year, no? I think kung tingnan natin itong mga surges na sa ibang bansa, it goes up, it goes down, it goes up. So if that follows the same trend here in the Philippines, klaro-klaro, no? I mean, let's not be concerned of infection levels, provided Omicron is still the variant which is proven to be mild. At nakita ko ngayon dito, may lumabas yung CDC na report na the second booster actually enhances the protection, no, against severe and death, no. So that's another argument why we have to give the second booster shot to the 50 years old and above, no. So all of these things, the private sector, of course, is concerned na we really want to keep the economy open. Hindi na natin kaya magsirado, especially with this crisis of high prices coming out, no. At kung i-lockdown natin, mas lalong dalawang problema ang mangyari sa atin, no. So this is why we are starting this afternoon, no, to discuss. Now, there may be positions that are very far apart. We will see whether this advisory group will be cohesive enough to work together, no. But I mean, these are well-respected doctors, and if we can improve our communication with and when we come out in the media and say one voice, no, and at least hindi magugulo, no.
Okay. Pero ito, sa usapin naman po no, nung hybrid o yung setup po sa mga work from home na ini-encourage po at sinasuggest na ng ilang mga commuters po na sana maipatupad na lang sila na work from home dahil po sa taas ng presyo po ng petrolyo. Do you believe this will help at least no, dahil wala rin humasakyan, ano, karamihan talagang hirap po sa transpo natin ngayon?
Well, hindi naman pwedeng lahat kasi karamihan ng mga empleyado namin, factory workers yan, no? Yung mga office workers natin, kukunti lang naman yan, eh. Depending on the sector, katulad ng supermarket, hindi naman kaya, walang merchandisers, walang kahera dyan, no? So, all of these people are really on, especially in retail, no? Restaurants, whatever, no? Almost all have to be present, except yung, siguro yung mga accountants, yung mga depende sa mga IT. So office support service, maybe not all the time. Pero just as I say, an example is on our own corporation. We have already declared Friday work from home, no? Just Friday alone. Except for those who have to be in the office or in the factories, no? Or else walang aandar na mga makina, no? So, and bulk of our employees are in that sector, no?
So, okay, sige po. At maraming salamat muli sa pagbibigay niyo po sa amin ng oras dito po sa Balitang Hali, sir.
Thank you, Connie.
Yan po naman si Presidential Advisor for Entrepreneurship, Joey Concepcion.